Welcome, everyone. Good afternoon and guten Morgen. Thank you for joining us for today MiDAS-KAS Conference 2020. My name is Norhayati Muhammad Nordin from the Malaysian Institute of Defence and Security, or MiDAS, under the Ministry of Defence Malaysia. Today and tomorrow evening, we are hosting a conference on pandemic response and beyond, presented by distinguished local and international speakers. After a brief housekeeping, I will be turning over this conference to our moderator, Ms. Nadia, to moderate the entire conference. Just a little housekeeping before we get started. If you have any questions during the presentation, please type them into the Q&A box in your Zoom control panel. Any questions in Deutsch will be forwarded to relevant speakers and answered later via email. Now, without further ado, I would like to invite Ms. Nadia, our moderator for today and tomorrow's session, to start our conference. Thank you. Ms. Nadia, please.
Thank you, Aini, for the introduction. Hello, everyone, and welcome to the MiDAS-KAS Conference 2020, entitled Pandemic Response and Beyond. I'm Nadia Azmi, hosting live from Kuala Lumpur, Malaysia. On behalf of MiDAS and KAS, thank you to all of you who are joining us today on Zoom from wherever you are. Now, ladies and gentlemen, it's now the month of December where the past 10 to 11 months have shown a progression of drastic changes affecting the way we live, work, and learn, bringing to where we are today. Reliance on technology has never been broader and deeper, in which today's conference is actually evident to that as we are gathered here on a virtual platform. COVID-19 has been the headlines for almost a year now, and even with vaccines coming our way, the fight isn't over. The pandemic is not just a national issue across the globe, but rather a battle that must be fought together globally. While the implementation of pandemic measures has differed in each country, there are surely lessons to be learned. So today's conference has pooled together a brilliant lineup of experts and figures involved in the planning and deployment of these measures to talk about how we can move forward. To officially kick off the conference, let's hear a welcoming remark from Mr. Rusli, Acting Chief Executive of MiDAS. Ladies and gentlemen, as we wait for Mr. Norhisham, I'd like to remind the audience members that you can submit your questions through the Q&A box that we have here in Zoom. So as the presenters are presenting, you may submit your questions at any time throughout the discussion, and we will address these questions at a Q&A slot that we have after the presentations are made. I've just been notified that Mr. Norhisham will give his opening remark in about 5 more minutes, as we will begin at 3 p.m. In the meantime, welcome again to everyone who is joining us here today for the MiDAS-KAS Conference 2020, entitled Pandemic Response and Beyond. I'm Nadia, and I'll be your moderator today. We are live from Kuala Lumpur, Malaysia, and we have a brilliant lineup of speakers today who are not just from Malaysia, but also from Germany, joining us to give us some insights on the pandemic that we are experiencing today and the responses that should take place and how we are doing so far globally in fighting the COVID-19 battle. We will have 2 sessions for today, and the first session will comprise of 3 speakers who will I be introducing shortly. And after the three presenters have given their presentation, there will be a Q&A session towards the end where we will open up the floor to the audience members for you to submit your questions, ideas, and anything that you have in mind through the Q&A box that we have here on Zoom. And don't forget to also state the name of the speaker who you would like to direct the question to. We will also have a poll before the Q&A session later on, so stay tuned for that. We would like to know your thoughts and your feedback on the current pandemic and how we are dealing with it as a country and as we are dealing with it globally. So once again, welcome to everyone who is joining us for the MiDAS-KAS Conference 2020 on Zoom. We are glad that you are able to take the time to join us for this two-day conference. As I've mentioned, we have two sessions for today. The first session will have three speakers whom I will be introducing later on. And the second session, we will also hear from another lineup of three speakers. The first session will be about how the pandemic has been going on so far. It's been almost a year since this COVID-19 has made an appearance. And then the second session with another three speakers, we will talk about and delve deeper into the development of SOPs in combating the COVID-19 pandemic. So we hope to hear from you as well as the audience during the Q&A session. We would want to make this as interactive as possible despite the conference taking place on a virtual platform. Ladies and gentlemen, we will begin shortly in about 2 minutes, where we will officially kick off the conference with a welcoming remark from Mr. Rusli, who is the Acting Chief Executive of MiDAS. I see that we have more participants who have been joining us on Zoom. We'll begin momentarily. Welcome to everyone once again to the MiDAS-KAS Conference 2020 Pandemic Response and Beyond. We have two sessions today with the lineup of 6 brilliant speakers with expertise whom we would surely want to hear from looking at the situation that we are in right now with the COVID-19 pandemic.
It's 3 o'clock.
My clock says it's now 3 p.m. Hello, everyone, and welcome to the MiDAS-KAS Virtual Conference 2020 entitled Pandemic Response and Beyond. Again, I'm Nadia, hosting live from Kuala Lumpur, Malaysia, and it's great to have everyone joining us here today from wherever you are across the globe. Now, for the first session that we will have 3 speakers. We'll talk about the pandemic in general. But before we go on to the first session, we would like to kick off this conference by hearing the welcoming remarks from Mr. Rusli, who is the Acting Chief Executive of MiDAS.
Thank you, Ms. Nadia Azni, our moderator today. Bismillahirrahmanirrahim. General Tan Sri Datuk Sri Haji Affendi Buang, RMAF, Chief of Defence Force, Malaysia, Mrs. Miriam Fisher, Director of Konrad Ordnance Stiftung, KAS, Office, Malaysia, Datuk, distinguished panelists, ladies and gentlemen. Assalamualaikum warahmatullahi wabarakatuh and a very good afternoon. Welcome to the Malaysian Institute of Defence and Security MiDAS and Konrad Ordnance Stiftung KAS Conference 2020, or better known as MiDAS-KAS Conference, titled Pandemic Response and Beyond, held from today and tomorrow. Alhamdulillah, despite the COVID-19 pandemic, we still managed to co-organize this event and provide a platform for discussion on the effects of the pandemic itself to our daily lives. We are truly honored that the Honorable Yang Berhormat Datuk Sri Ismail Sabri bin Yaakob, Minister of Defence Malaysia, will be delivering the keynote address. Allow me to take this opportunity to convey my heartfelt appreciation and gratitude to our Minister for taking the time to commit to this event. My sincere appreciation also goes to all our distinguished panelists. For our event this week, we have gathered experts from the government sector, think tanks, and international organizations that will discuss on the various response to the pandemic, challenges in developing ad hoc new SOPs, the effects of the pandemic towards our security, and its impact towards the social, politics, international relations, and the global economy. Tan Sri, Datuk, ladies and gentlemen, I believe that our virtual conference is timely as we are witnessing lockdowns, countries closing borders, the slump in consumer spending, and jobs disappeared almost overnight. Indeed, this tiny, sneaky bug struck the world economy with the biggest shock since the Second World War. In addition, the pandemic has also caused emotional distress to many, following the change in the working environment. Malaysian government psychosocial hotlines received nearly 12,000 calls seeking emotional support and counseling for stress, anxiety, and loss of hope. Sadly, the trends in suicide are also rising during this pandemic. On the security perspective, COVID-19 has demonstrated its own security issues, including a spike in its social unrest, police enforcement, and crime in all over the world. In Malaysia, we are fortunate that the public adhered to the SOPs. The crime rate was low during the movement control order, and nonetheless, few crime cases caught our attention recently. Perhaps few people are desperate and emotionally stressed. From the terrorism standpoint, terrorist activities remain as usual, particularly in the social media. The COVID-19 gave a new narrative for terrorists and can insight to the nature terrorists will capitalize the situation for their own benefit. Government has responded to the issues that I have mentioned. Our responses have a disproportionate influence on the citizens' perspectives and response. We can only see the impact of the responses perhaps 6 months to a year from now. Nevertheless, there are avenues to make a breakthrough in confronting this phenomenon. In hand with the webinar forum held today to indulge in addressing this issue further for an extensive, beneficial outcome to all parties involved. Tan Sri, Datuk, ladies and gentlemen, I wish I could meet everyone in person. Alas, we are committed to our procedures and the pandemic situation is still fluid. On the positive side, our German colleagues and other foreign speakers are not taking their flights to Kuala Lumpur, and I believe that has in a way reduced carbon dioxide emission and global warming. We are indeed in a win some, lose some situation here. To conclude, once again, I would like to thank the Honorable Yang Berhormat Datuk Sri Ismail Sabri bin Yaakob, Minister of Defence, for his unwavering support for this event, despite the busy schedule he has. I also like to thank the KAS office in Malaysia for choosing MiDAS as their local partner and willing to collaborate with MiDAS to co-organize this conference. Last but not least, thank you to all participants for supporting this conference. And I do wish everyone a successful discussion. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Waalaikumsalam warahmatullahi wabarakatuh. Thank you very much, Mr. Noor Hisham. Now, ladies and gentlemen, a keynote address from Malaysia's Minister of Defence, Yang Berhormat Datuk Seri Ismail Sabri Yaakob.
The world, and good morning to those in Germany and elsewhere. It gave me great pleasure to be online today. Please first allow me to thank the organizers, Malaysian Institute of Defence and Security, MiDAS, and the Conrad Adenauer Stiftung, KAS, Malaysia, for inviting me to deliver the keynote address for MiDAS-KAS Conference 2020 titled Pandemic Response and Beyond. Therefore, congratulations to MiDAS and KAS Malaysia for organizing this event. I am told that this online conference has brought together over 100 policymakers, professionals, operators, think tanks, and academia from Malaysia and various parts of the world. The sudden attack of COVID-19 has taken an overwhelming toll on nations around the world, with the loss of over 1.54 million of valuable lives. Hence, I would like to request that we take a minute of silence for those who have tragically passed away due to COVID-19 as an expression of our condolence to their families. Esteemed moderator, speakers, and participants, I remember that I came into office as the Minister of Defence and the Senior Minister for Security on 10 March 2020. The very next day, the World Health Organization, or WHO, announced COVID-19 outbreak as a pandemic. 6 days later, on 16 March 2020, our Prime Minister announced via telecast the implementation of Movement Control Order, or MCO. As the Senior Minister for the Security Cluster, I was put overall responsible of our pandemic responses, and it has certainly been a whirlwind experience. I have been a minister to various ministries prior to this, but all my previous experience in no way would have prepared me for this. However, as a senior minister, it is certainly a new experience to be working with multiple ministries and agencies, civilian as well as uniform, in responding to COVID-19 pandemic. Throughout this experience, the very important aspect of the whole government and society approach that our defense white paper has been preaching was certainly reflected in the responses we have taken against COVID-19 pandemic. In Malaysia, we have seen bersatu kita teguh, bercerai kita roboh, which means together we are strong, divided we fall. This also reflects our civil-military cooperation in responding to COVID-19 pandemic. Ladies and gentlemen, ever since that fateful day that I was put in charge of the response, I have almost constantly been at the National Security Council or NSC. The Prime Minister Office and other NSC members are on my speed dial, and endless updates and meetings are the order of the day. We have terms working on the details of each phase of the MCO and also on the development of SOPs. This had to consider mainly the health and security of our nation in order to maintain the well-being of our people. The recent resurgence of the pandemic is an indicator that even a small lapse in control is extremely detrimental. The government has implemented again the Conditional Movement Control Order or CMCO in certain states to break the chain of transmission and save life, and also to safeguard our essential health services. However, please lend me your ears to something that directly concerns all of us. We have listened frequently about the uncommon nature of the COVID-19 pandemic. The IMF portrays it as the emergency like no other because it impacts all nations at the same time, not just in terms of public health, but also in terms of socio-economic well-being and security of the worldwide populace. Nevertheless, Malaysia has been recognized as one of the most successful countries in handling the socio-economic impact of the COVID-19 pandemic. According to the Malaysian Ministry of Finance, Malaysia's gross domestic product, GDP, is expected to contract by 4.5% in 2020 before regaining its growth in 2021 by 6.5% to 7.5%. In recent weeks, we have seen the pandemic continuing to peak in some countries and returning in others. And amidst this uncertainty, the steps for reopening and reinventing remain unchanged. But countries must now consider how the pandemic impacts the recovery strategies across different geographies. Esteemed speakers and participants, the COVID-19 pandemic has radically modified the maritime domain by emphasizing social and political gaps that exist along Asia-Pacific's coastline, such as internal political insecurity and financial grievances. These gaps have spilled over into the maritime domain as report of wrongdoing such as illegal, unreported, and unregulated fishing, piracy, armed robberies, as well as illegal immigration has increased since the onset of the pandemic. In today's context, illegal migration is no longer a simple case of a person crossing borders without proper documentation. Today, it has become even more complex as we are unsure if there could also be a mule for the virus that is harmful for the locals. For Malaysia, this has certainly been the case as reflected by the statistic rising in several illegal immigrant detention centers that has also spilled outside infecting the local masses. In order to overcome such threats, Malaysia has implemented inter-agency cooperation such as Corps Benteng to protect maritime borders, and this is an example for a whole government approach and civil-military cooperation. However, ops betting is not the only civil-military operation that is currently in operation. Other examples are the MAF Field Hospital in Tawau, which has increased Tawau Hospital bed capacity by 25%, the Integrated Enforcement Immigration Operation, which has increased the numbers of illegal immigrants caught, as well as the Joint Roadblock Operation with Royal Malaysia Police in enforcing CMCO. Civil-military cooperation has and will probably be the future norm. Based on the current situation in Malaysia and other ASEAN member states, whereby militaries are deployed to assist, it would be most beneficial for ASEAN to tap resources from the ADMM plus expert working group in military medicine and humanitarian assistance and disaster relief. Currently, ASEAN already have ASEAN Military Ready Group to respond to natural disaster. However, from the current pandemic experience, it would be advantageous if we could explore how the existing military resources could be utilized for addressing pandemic across the region. Ladies and gentlemen, hence being completely mindful in these dangers which might cause long-term harm to security, society and economy, the Malaysian government made the actualize its 6R technique, that is resolve, resilience, restart, recovery, revitalize and reform. Furthermore, in order to ensure 6R technique is successful, there is a high need for cooperation beyond just national level in the wake of COVID-19 pandemic. Therefore, it is my fervent hope that we could discuss attentively and gain knowledge from this online conference. I sincerely appreciate the effort and initiative undertaken by MiDAS and KAS to realize the implementation of this virtual conference, and I look forward to the outcome of this event. Thank you. Assalamualaikum warahmatullahi wabarakatuh.
Thank you very much, Yang Berhormat, and thank you, Yang Berhormat, for your service to the country, especially during these trying times as we fight the pandemic of COVID-19. Now, ladies and gentlemen, the last time the WHO declared a pandemic was for the H1N1 virus or the swine flu in 2009. While experts and scientists did anticipate the discovery of new viruses during this lifetime, we certainly did not expect what 2020 had in store for us, the COVID-19 pandemic. So how did we respond? Our first panel of speakers will take a look back at how countries responded to the pandemic and the improvements that can be made. But before we start, I'd like to remind once again the audience that there will be a Q&A session at the end of this first session. You may submit your questions through the Q&A box, and don't forget to state the name of the speaker you would like to put forth your question to. We will also have a poll before the Q&A session. We would like to hear from you. We would like to hear your thoughts. So stay tuned to that. Now, our first guest speaker is General Tan Sri Haji Affendi Buang RMAF, Chief of Defence Forces Malaysia. He joined the Malaysian Armed Forces as an RMAF officer cadet in 1980 and received his basic training at the Officer Cadet School in Sebatang Kara, Port Dickson. He is one of the founding members of the RMAF MiG-29 Tactical Aerobatics Team, popularly known as Smoke It Bandits. General Tan Sri Datuk Sri Haji Affendi believes in the importance of gaining knowledge to increase competency and proficiency in handling tasks. In fact, in recognition of his capacity, he was presented with the opportunity to learn, experience, and network at the Royal College of Defence Studies, London in 2011. So without further ado, I would now like to pass the floor to General Tan Sri.
Okay. Since the beginning of our effort to contain the COVID-19 pandemic in Malaysia, the Malaysian Armed Forces has been mobilized as frontliners, either in direct deployment or support for various aspects of the national plan to mitigate the COVID-19 pandemic. Currently, there are more than 5,527 Armed Forces personnel, together with the various land, air, and maritime assets being mobilized as the frontliner daily in response to control the spreading of COVID-19 pandemic in Malaysia. This deployment has been ongoing continuously for the past 9 months, and as the first responder to fight this pandemic, we will continue to give our full commitment in this campaign until the government declare that the pandemic is no longer a threat to the nation. Distinguished guests, ladies and gentlemen, Assalamualaikum and very good afternoon. As the Chief of Defence Force, it is indeed a privilege for me to address this important forum. I appreciate the effort by the combined organizers, MiDAS and KAS, that has driven this event into a reality. I will be presenting my view on pandemic response from the Malaysian Armed Forces perspective, and hoping that you all will have a better understanding on the Malaysian Armed Forces response when dealing with crisis and strenuous environment. Before I go any further, let me clear to the audience that the involvement of the Malaysian Armed Forces during this difficult time is strictly with the aim to control and reduce the spreading by means of general population movement control through Ops Penawar, and secondly, to mitigate imported cases by protecting the borders from being infiltrated by illegal immigrants through Ops Benteng. I am proud and delighted to report that with regard to these two operations, combined with the whole of government approach, the presence of the Malaysian Armed Forces in this campaign has really helped the government to alleviate and mitigate the worst effect of this pandemic. Malaysian Armed Forces' primary role is to protect and defend the sovereignty, national interests, and territorial integrity from any threat, with a broad aspect of responsibility derived from this primary role. The Malaysian Armed Forces have to be ready in full spectrum of capability befitting a modern, robust military formation. This is not to say that we are geared solely for war fighting, but rather that for that particular aspiration of achieving full spectrum capabilities. Malaysian Armed Forces possess significant multi-domain capabilities. Thus, I am happy to share 3 significant aspects that the Malaysian Armed Forces demonstrated throughout the effort mitigating this pandemic that has generally enabled us to successfully provide better effect to the nation. Firstly, with the Malaysian Armed Forces capability and capacities to operate in multi-domain threat and in a stressful environment, the Malaysian Armed Forces has the capacity to organize, the flexibility to form and reform units, and the ability to mobilize our resources at a scale that no other part of the government agencies could afford. The fact that I have mentioned earlier in my opening shows how we are able to shift our priority from defense of the nation, from external threat to civil authority and security assistance to ensure the safety and security of the population are maintained at all times. And an example of this is how Malaysian Armed Forces managed to assist the Royal Malaysian Police in its policing duties for the first phase of the movement control orders. Over the subsequent period of the MCOs, it has been demonstrated as well that the Malaysian Armed Forces logistic support enable rapid mobilization of personnel and asset at intra-state level, as well as across the two-theatre operation, which is Peninsular Sabah and Sarawak. Secondly, the Malaysian Armed Forces are adaptable and self-sufficient organization, highly suited for crisis response and management. The Malaysian Armed Forces personnel has been trained in various specialization to achieve such a full spectrum combat capability, but the same expertise can also be then reorganized to support humanitarian relief effort. From the lowest technical level, such as drivers and technicians, to the highest specialist level, such as doctors and engineers, the Malaysian Armed Forces is able to optimize our presence in varying level of crisis response and management. A primary example to this effect was the deployment of Malaysian Armed Forces personnel to assist the national health infrastructure in mitigating the COVID-19 transmission. We have seen how the Malaysian Armed Forces deploy rapidly to secure COVID-19 red zone during the CMCO or during the control movement orders and the enhanced control movement orders, with infantry soldiers deployed securing the parameters with engineers in tow to deploy the concertina wire barricade overnight, beginning with the enhanced MCO of one city, and since then in almost every COVID-19 targeted hotspot. At the same time, military medical personnel were also deployed in various capacities across the nation to assist the front lines of the COVID-19 treatment facilities. I believe we all should acknowledge the fact that the military expertise largely assisted in the establishment of COVID-19 treatment facilities in Maep Serdang that saw rapid deployment of assets to ensure an effective conduct of treatment for large amount of COVID-19 cases then. Within these last 9 months, we have seen time and again Malaysian Armed Forces personnel being called to the forefront for assistance, primarily due to the rapid deployment capabilities that it possesses. At the same time, there are also Malaysian Armed Forces personnel that are called upon to complement the organizational structure of government agencies such as National Security Council and National Disaster Management Agencies. When the pandemic first began, the Malaysian Armed Forces National Resilient College assisted the National Security Council in developing various response and options to mitigate this pandemic. With their combined experience, the Malaysian National Resilient College and the National Security Council generally developed template for the current SOPs being implemented today, as well as a joint common operating picture for future use. This sufficiently demonstrates the highly adaptable and rapidly mobilized self-sufficient capabilities that the MAF possess that assisted largely the COVID-19 mitigation effort in Malaysia. Thirdly, and the final aspect that is quite important to highlight is that while this pandemic is a calamity of unprecedented scale, it provided an opportunity for the Malaysian Armed Forces prove ourselves to the citizen and taxpayer of Malaysia. They were once called upon the reason for being of an armed forces in Malaysia, that why such large amount of money spent to maintain the armed forces. Unfortunately, it takes such a tragedy like COVID-19 to realize the relevancy of the Malaysian Armed Forces in this case. As stated in the first and second aspect above, the capabilities and capacities possessed by the Malaysian Armed Forces enable such a solid response and we aim to undertake this opportunity as well to demonstrate the full resolve that the Malaysian Armed Forces has sworn toward defending this nation from any threat. I sincerely believe that each and all of the Malaysian Armed Forces personnel are committed toward the service for the nation, and it is our duty to ensure that we provide the valuable services worth the money spent upon the Malaysian Armed Forces. Ladies and gentlemen, in our quest to provide better services to the nation, we do require support to ensure that we can sustain for a longer period of such high tempo of operation. Malaysian Armed Forces foresees that there are two important matters that need to be resolved quickly, effectively, and efficiently. First and foremost is the need to have more surveillance and intercepting assets to cover each corner of our borders. What we have now is still not enough considering the porous nature of our borders, as well as the push and pull factors that the illegal immigrants and transnational criminals to continue the effort to penetrate our borders rampantly. The unwanted presence will have an impact to our sociological and economic stability, and worst of all, has the potential of transmitting the COVID-19 pandemic along with them, thus disrupting the government effort to stop this pandemic. By having more of this equipment, our men will be able to piece together better information and intelligence from continuous surveillance and monitoring of the border, thus enabling a much efficient and effective interception of illegal entrance across our border. Additionally, it will reduce the dependency on large amount of personnel needed for surveillance, which in turn increase efficiency in human resource. The second aspect to this matter is of the population awareness on a need for a whole of society effort toward mitigating the pull factors for illegal immigrant. Surveillance, monitoring, detection, interceptions of illegal entrance into Malaysia must be complemented by a whole of society effort which need the population to be aware and varying aspects related to why illegal immigrants are danger to the nation. Currently, despite all the advisory and measures undertaken to enforce our border security, there are still some issues with the compliance among the general population. The government, together with security agencies, have put a lot of effort toward curbing illegal entries, but the whole of society must come together so as to ensure that the illegal immigrants are not given sanctuary. We must follow the new norms and promulgated SOPs, otherwise without this awareness, all of our hard work and relentless effort will be a waste. In conclusion, I hope that you all now have better understanding of the Malaysian Armed Forces response during this pandemic. Combating this pandemic is indeed a challenging task even for a properly structured organization like us. Nevertheless, Malaysian Armed Forces alone cannot resolve this crisis. It is my sincere hope that we all, the military and civilian organization or individual, should commit and continue working together if we wanted to achieve overall success of this campaign that have been specified by the government. With that, I end my presentation and thank you.
Thank you very much, General Tan Sri. Now, I'd like to remind the audience members once again that we will have a Q&A session. At the end of this first session, we'll open up the floor for questions from you. Please do submit your questions through the Q&A box that we have here on Zoom, which we will address later during the Q&A session. Now, ladies and gentlemen, our next speaker is Datuk Dr. Norhayati Rusli, Director of Disease Control Division in the Ministry of Health, Malaysia. She was also appointed as a board member of SOCSO, representing the ministry. Datuk Dr. Norhayati has contributed greatly to Malaysia's recognition as one of the countries that has successfully met all health needs under IHR 2005 by WHO and is one of the pioneers of the ASEAN Emergency Operations Center or ASEAN EOC network initiative. She is actively involved in managing preparedness and response to epidemic and national disasters in Malaysia, such as the Sungai Kim Kim chemical contamination in 2019, measles outbreak in Kelantan, and polio outbreak in Sabah also in 2019, and now the COVID-19 pandemic. With that, the floor is yours, Dr. Norhayati.
Okay, thank you very much, Ms. Moderator, Ms. Nadia Azmi. Okay, obviously I'm not Datuk Dr. Norhayati, I'm Dr. Wan Noraini, Wan Muhammad Noor. First and foremost, please accept Datuk Dr. Norhayati apology for not being able to attend the session this afternoon. Indeed, she is really sorry about her absence, but she is currently involved with another meeting in Parliament Malaysia. So I'll be presenting this on behalf of Dr. Norhayati. Okay, distinguished participants, ladies and gentlemen, Assalamualaikum and a very good afternoon to all of you, and good morning to colleague from the other side of the world. So at the outset, I would like to thank the organizers for having invited me to be as one of the panels at the MiDAS-KAS Conference 2020. Besides, I would like to take this opportunity to congratulate the organizers for their commitment in organizing this conference, which brings together various relevant experts in one platform to address critical challenges that all of us face during this current pandemic. Okay, in March 2015, Bill Gates has told delegates at the TED Talk about the next outbreak. Are we ready? So this is where Mr. Gates revealed the facts that his fears related to another outbreak of an epidemic in the world. So Bill Gates started his TED Talk by bringing up the fears of a nuclear war that he faced at the time of his youth. However, later he said that the greatest threat that mankind might face in the future is not nuclear war, but an outbreak of an epidemic. And according to Gates, if anything kills 10 million people in the next few decades, it is most likely to be a highly infectious virus rather than a war, not missile, but microbes. And the predictions so far have been true in the form of this coronavirus pandemic, for which the world is still striving to fight. And Bill Gates predicted that the next outbreak would be more devastating than Ebola epidemic in West Africa that we have seen in 2014. And he said that the failure to prepare could allow the next epidemic to be dramatically more devastating than Ebola. And Gates cited that the fact that Ebola did not reach many urban cities, or else the result would have been greater. And next time, we might not be so lucky indeed. We are not lucky this time, and his word has somehow predicted this coronavirus epidemic dangers. So these are 7 reasons we are at more risk than ever at a global pandemic. The first one is growing population and urbanization. And this is where, with people moving more regularly from and between rural setting to urban ones, the chances of them becoming infected and then living in close quarters with others further boost the potential for things to spread. Secondly, encroaching into new environments, because as we know, as numbers of people grow, so does the amount of land needed to house them. And the populations expand into previously uninhabited territories such as forests, and with new territories comes contact with new animal and inevitably new infection. Third one is climate change. Evidence continues to emerge that climate change is resulting in greater numbers of heat waves and flooding events, and bringing more opportunity for waterborne diseases such as cholera, and for disease vectors such as mosquitoes in new regions. And then next is global travel. The infectious agent travel around in humans many times within their incubation period. And we have seen that as well in COVID-19. So an incubation period is a time when between the infection and the onset of symptoms, meaning people can transmit an infection though they won't appear to be sick. And next is civil conflicts, in which If a country is on the brink of breakdown from civil unrest, the ability to handle an intense and sudden problem like an outbreak could bring its people to their knees, and this indeed will allow the infection to flourish. And we have seen in various regions of the world where there are fewer doctors and nurses. And beyond this weak health system, countries where outbreaks are more likely to occur, namely more developing settings, also have fewer doctors and nurses to treat the population. And most of this personnel have left their country for better prospect elsewhere. And last but not least, this is something that is very, very much related and very much the contrast of what we are having at the moment in comparison to the last pandemic in 2009, which is faster information. So we are here in the information age where new levels of communication bring even newer levels of fear and multiple ways to spread it, and what the terminology being introduced as infodemic, in which instant communication everywhere raises the possibility that false rumors will spread during a crisis. So worst case, fearful rumors may trigger panic, which might hinder emergency responder. So this is, we're not only facing the virus, but as well the viral news. So these are the criteria of the likely candidate to cause a pandemic, whereby previously experts are anticipating that it will come from a highly pathogenic avian influenza A viruses as the source of the next pandemic influenza virus strain. Because this influenza virus, it is very efficient at having these three criteria. First one, it can become a novel virus because of the mutation occurring. And then secondly, it has the ability to cause serious illness. And thirdly, it has the ability to spread easily from human to human, or what is known as a sustained human to human transmission criteria. So for centuries, novel strains of influenza have emerged to produce human pandemics that cause widespread illness, death, and disruption. Since 16th century, influenza pandemic have been described at intervals ranging between 10 to 50 years with varying severity and impact, whereby within the past 100 years, we have seen 4 of them, which is the emergence of novel influenza strain in 1918, or better known as the Spanish flu. And then in 1957, the H2N2 Asian flu. And then in 1968, the H3N2 Hong Kong flu. And last but not least, in 2009, we had the pandemic H1N1 swine flu. And with each pandemic, researchers, public health experts, and international organizations have gained better understanding of the complexity and dynamics of influenza pandemic. And with the improvement of surveillance and reporting systems, more data and characteristics of viruses can be documented than was possible a decade ago. So the International Health Regulation, or better known as IHR, first adopted by the World Health Assembly back in 1969, and it was last revised in 2005. It is a legally binding instrument of international law that aims for international collaboration with the objective to prevent, protect against, control, and provide a public health response to the international spread of disease in ways that are commensurate with and restricted to public health risks, and that avoid unnecessary interference with international traffic and trade. In 2005, what happened is that following the SARS outbreak, several changes were made to the previous revised IHRs originating from 1969. And following which, the IHR 2005 was entered into force on 15 June 2007, whereby the emergence of the new influenza virus in early 2009 was the first influenza pandemic since the adoption of this IHR 2005, and that is the first one in the 21st century. So the COVID-19 pandemic took the world by surprise indeed and unfolded extremely rapid. It began relatively slower, and only a little is documented on its actual first case, with claims as from November 2019, while others link it to December 2019. Chinese doctors only came to realize that they were dealing with a new and serious virus late December 2019, when similar symptoms continued to increase every day, which gave rise to cluster of cases of unknown pneumonia of unknown origin, and this mostly originating from the city of Wuhan in Hubei province. And on 1st of January, the Wuhan Huanan seafood wholesale market was indefinitely closed following its associated link with the virus outbreak. And after rigorous probe tests and analysis, the Chinese authority made a global announcement on 7th of January that they have successfully identified the virus as a novel coronavirus similar to the one associated with SARS and the Middle East Respiratory Syndrome, or MERS. So on January 11, the Chinese health authorities shared unfortunate news that 61-year-old man who had been admitted in one of the hospitals in Wuhan had died. And from the report, the man had other underlying health condition, and the cause of the death somehow or other attributed to COVID-19. While no new cases were reported in Wuhan or in other part of China beyond its border, then Thailand confirmed their first case on 13th of January 2020. And this was also thought to be the first international COVID-19 case. So after 12 months down the line where we are now, globally there have been more than 67 million confirmed cases of COVID-19 all around the world, including more than 1.5 million deaths reported. And for Malaysia alone, up till 8th of December, we have 75,306 cases, and this is inclusive of 388 deaths altogether. So this is taken from the WHO DG opening remark during his media briefing on COVID-19 on the 13th of July 2020, whereby he described there are roughly 4 situations playing out across the world at the moment when talking about COVID-19. The first situation is countries that were alert and aware, whereby they prepared and responded rapidly and effectively to the first cases. And as a result, they have so far avoided large outbreak. Leaders of those countries took command of the emergency and communicated effectively with their population about the measures that had to be taken, and they pursued a comprehensive strategy to find, isolate, test, and care for cases, and to trace and quarantine contacts, and were able to suppress the virus. The second situation is countries in which there was a major outbreak that was brought under control through a combination of strong leadership and population adhering to key public health measures. So in both of these first two situations, where countries have effectively suppressed the virus, leaders are opening up their societies on a data-driven, step-by-step basis with a comprehensive public health approach backed by a strong health workforce and community buy-in. And the third situation is, I would say, similar to the situation that we are facing here in Malaysia, is where we are seeing in countries that overcome the first peak of the outbreak, but having eased restriction, are now struggling with a new peak and accelerating cases. So in several countries across the world, we are now seeing dangerous increases in cases and hospital wards filling up again. And it would appear that many countries are losing gains made as proven measures to reduce risk are not implemented or followed. And the fourth situation are those countries that are in the intense transmission phase of their outbreak, and mixed messages from their leaders undermine the most critical ingredient for any response, that is the trust. And the government do not clearly communicate with their citizens and roll out a comprehensive strategy focused on suppressing transmission and saving life. And their population do not follow the basic public health principle of physical distancing, hand washing, wearing face masks, cough etiquette, and staying at home when they are sick. So these are the Malaysian scenario, where due to the experience in containing past infection such as Nipah viral encephalitis in 1999, SARS in 2003, series of HPAI or highly pathogenic avian influenza H5N1 outbreaks since 2004, the pandemic H1N1 in 2009, as well as MERS coronavirus outbreak once in 2014 and another one in 2018. This has made Malaysia more prepared to deal with the current situation which we are now. We have the National Influenza Pandemic Preparedness Plan, or the NIPPP, that have been prepared by our National Influenza Pandemic Technical Committee, and represent a broad consensus among the committee, which is chaired by the Director General of Health, and it comprises of core multidisciplinary and interagency departmental representative and expert. Secondly, Malaysia has made tremendous progress in strengthening the capacity in health security and implementation of the International Health Regulation or IHR 2005 in the last decade. And guided by the two iteration of the Malaysia Strategy for Emerging Diseases and Public Health Emergencies Work Plan, or better known as MISET, Malaysia has implemented a step-by-step strategy for health security strengthening. So MISET 1 and MISET 2 were developed through a multi-sectoral collaborative approach, and Malaysia has also used our response to MERS coronavirus cases as an entry point to enhance our preparedness in health security. So the preparation of Malaysia for COVID-19 pandemic was initiated since end of December 2019, and this slide summarizes the 6 key strategic approaches that Malaysia has adopted in our fight against COVID-19, and they are the public health intervention, diagnostic and testing, movement control order, the evidence-based approach and guidelines, risk communication, as well as isolation and treatment. So far, we are trying our best to admit all positive cases being detected. So although I've described them separately, these strategic approaches are interrelated, complementary, and synergistic to one another. And one of the key facilitators for the whole of government approach is the leadership provided by the National Security Council, or better known as NSC, headed by the Prime Minister of Malaysia. So the NSC is the agency under the Prime Minister's Department, and is the lead agency coordinating Malaysia's response to the COVID-19 pandemic. So there is a myriad of complex factors to consider when trying to strike a balance between overcoming COVID-19 pandemic and restoring the economy before any damage is caused. So a prolonged lockdown is economically not sustainable, but a premature lifting of the lockdown before the disease transmission is under control can backfire with a third wave of infection greater than the second one. And we have witnessed that in Malaysia. So this leaves slippery middle ground of easing of certain public health measures in a controlled manner, or as much as control as they can be, and slowly releasing the brakes on the economy. So throughout human history, there have been a number of pandemics, as what I've shown before. So indeed, the COVID-19 pandemic is not the first pandemic, nor will it be the last pandemic to affect the world. So nevertheless, the world have never before seen a pandemic sparked by a coronavirus. And this is the first pandemic caused by a coronavirus in human history. This unprecedented global pandemic has highlighted the true vulnerability of human life. It is a challenge on the global level since the COVID-19 pandemic does not respect national boundaries. But it is just as much a challenge on the national level where many of the policy decisions in response to the pandemic are made. And at the local levels where people decide on whether to comply with the government guidelines and whether to support one another in times of need. So every one of us, from heads of state to ordinary citizens, bear great responsibility for the health and well-being of others. So this pandemic is a reminder of the strategic importance of publicly accountable health system underpinned by investment in people and technologies. So we must continue to build upon the lessons learned so far from the management of COVID-19 pandemic and adjust our approaches to this pandemic and to other future public health crises accordingly. And last but not least, global solidarity is the only way to win the war against COVID-19, and we need unified responses to face this pandemic rather than diverse, disconnected strategies. So we should be working together for the good of mankind. What we must not do is to blame one another in this time of uncertainty. So indeed, until every country is safe, no country is safe. So with that, I conclude my presentation by thanking you for the attention given. Thank you very much.
Thank you very much to Dr. Wan Norhayati. We apologize for the discrepancy earlier, ladies and gentlemen. That was Dr. Wan Norhayati Wan Muhammad. She is the head of surveillance sector and a public health physician from the Ministry of Health Malaysia. So we're glad, Dr. Wan Norhayati, that you are able to join us today in the absence of Datuk Dr. Norhayati. Now, I'd like to remind all of our audience members, when you key in your questions through the Q&A box for when we open up the floor later after this session, do indicate the name of the speaker that you would like to put the question towards. All right, now our third speaker is Colonel Dr. Rolf von Uslar, Head of Branch Health Service Support at the German Ministry of Defense Forces Policy Division. Having a PhD in medical dentistry and a Master of Arts, Military Leadership and International Security, Dr. Rolf's primary specialty is in medical operations and plans. He has received numerous awards and decorations, including the NATO Non-Article 5 Medal for ISAF and the Knight's Cross of the Order of St. John. It's a pleasure to have you join us all the way from Germany. With that, Dr. Rolf, the floor is yours.
Thank you very much, Nadia. It's a great pleasure and a great honor for me to be in such a distinguished conference, and thanks to MiDAS and to KAS to set up such a conference. I think it's very important in that times really to join our experiences, and I found out that it is a pretty good idea to learn from the best, and I think hearing the Malaysian concepts and seeing the results in Malaysia, I'm pretty sure that you are in Malaysia really the best dealing with such a pandemic situation, and we can learn a lot from you. Thank you very much. I've prepared some slides for you, and I hope that it can be seen. So I would like to give you a short overview what has happened in Germany and what has been our response, especially from a German military perspective. First of all, the situation in January, February was that we were we had respective knowledge on all these questions. So already in 2012, we published possible outbreak situation of a SARS virus. It was an assessment that has been done by our specialists, and it described pretty close what really happened 8 years later. It was published. It was read but the public and most high-ranking politicians didn't really take notice of it. So it is really a paradox that we didn't, let's say, learn the lessons from our experts, and I think that is a difference in the East Asian regions that you have already dealt with epidemic at least and slight pandemic situations, and so you have learned your lessons, and whereas in Europe the impact has been significantly underestimated. And my thesis is that the overall importance of health issues is generally underestimated. So we talk about economy, we talk about ecological issues, etc. But health, individual health is an issue, but public health is not very a popular topic in Germany, and so as a consequence, the preparations were, let's say, few. Especially if we found out that we had not enough reserves, especially in terms of individual protection gear, masks, etc., were not in that amount available that we wanted to have, and since we don't have any industry anymore that produces those individual protection gear, so as a nation at least, we were not able to deal with this situation very easily. Well, our pandemic response had another problem, and that was that command and control procedure. So how do we act and react in such a situation? Who is in control? Who can give orders, etc., was at least untrained. Yeah, so we started not completely with a white blank paper, but it was pretty close. So it was new for nearly everybody. And what was on the good side for Germany, that the clinical capacities proved to be pretty resilient. So we were pretty good at this. So in contrast to our European neighbors, in the first wave in March and April, we never faced a situation that our clinical capacities were so overstretched that we could not deal with the COVID patients anymore. So in such a crisis, it is clear, and General Tan Sri highlighted this for Malaysia already, that military forces are a good asset for a nation to support, because they have normally medical support, so they have some medical background. So for the German Armed Forces, the Bundeswehr, we have around about 20,000 soldiers serving in the medical service, and moreover, they are used to act in a difficult environment, in a crisis, under pressure, under austere situations. And so, of course, in Germany and elsewhere in Europe, the armed forces were tasked to support in the crisis. And the Bundeswehr, German armed forces, supported and supports still with more than 10,000 soldiers on a daily basis. So especially we support the civilian health system with helping hands in all those containment procedures. And so we found out that so we were not successful enough in the first wave in March, April to really contain the first outbreaks in Germany, because we lacked personnel, trained personnel, containment scouts, etc. PP, and so we pushed forwards to train soldiers to support in the civilian health system. Yeah, we supported with medical specialists. So our specialists, for example, from our laboratories, supported the civilian side. Scientists from the German Armed Forces supported by providing new tests and test capacities, and of course, to deal with the patients, we transported patients from regions in Europe that were overcrowded with patients, especially northern Italy and eastern France. So we provided medevac, so medical evacuation, with our fixed wing air assets, and So I already mentioned clinical and laboratory capacity. So our Bundeswehr hospitals supported in the region, but for foreign patients as well. And the logistical experts from the forces provided support, for example, for the protection gears, and they are now very busy in preparing the assistance for the vaccinations. And we were happy to be able to help other countries as well with ventilators, because that was really an issue in a lot of other European or NATO partner nations, that there was a lack of ventilators. So what are some of lessons identified I would like to share and discuss with you? So first and foremost, there is a significant need for clear strategies and a clear civil military C2 structure. C2 means command and control. And so we had some strategies, some papers, some ideas. As I mentioned already, a couple of years ago, we discussed that, but it was at least not trained and was not in the heads of the population and the decision makers. And so our reaction was slow and not smooth enough. So we can do better, and we will do better. So contingency plans are necessary, and civil military exercises. And for example, last week we made a big tabletop exercise. Actually, it was a war gaming with the name Resilient Response, together with a couple of European partner nations. And we did that in and civilian expertise as well. So it was really a comprehensive approach, and the baseline and outcome was we should do this significantly more often. So training of additional personnel. So what we did in a let's say hasty response, we containment scouts, etc. That is necessary to provide on a routine basis. So what we will foresee is that we have soldiers who are trained and who know where to support in a similar situation. Stockpiling is an issue, and again, it's not that every tiny nation should has their own stockpiling. So we need a stockpiling in Europe across the nations, and civil and military. But the thing is, we need resources to be resilient. And yeah, and what we found out is that the medevac issue is a big thing, because to bring patients from a region where the clinical situation is overstretched is important. And fixed wing aircrafts are a good opportunity, but for COVID patients, it is not a very good idea to transport them in an aircraft, because it's a lung disease, and so it's pretty difficult for them to deal with the transport trauma they have by this flight. And so we found out it would be a good idea to have a railway medevac transport, so transport by train. And so we are currently working on it. So the picture is a bit of a fake. You see on the right side in the middle, because the high-speed train with the Red Cross is not yet existing, but we're working on it in order to provide this transport. The French, they did it in a similar way. They used their high-speed train, and transported patients to the west, to the regions where they had less COVID patients. And I know that the Chinese, they have a similar train. So that is what we are looking for. One thing was that although we have a European Emergency Response Coordination Center, ERCC, in the really difficult situation in the late March and earlier April days, nobody used it. So it was a purely national issue to deal with the crisis. And as it was already mentioned today, such a crisis cannot be dealt nationally. It is a multinational effort. It is an international effort. It is a global effort, and we need institutions that can coordinate these efforts. Well, being in the military, I think not only about situations, pandemic situations that come up by nature, but that might come up by some bad people. So biosecurity is an issue. It is a very big issue, and again, this is not really on the desks of our decision makers, but it should be. And so we will use this point to highlight it and to be more to think more about this issue. And my last lesson identified on the let's say first year of COVID-19 is that we talked in the past always of health security in terms of ensuring health globally or locally or nationally, but we saw that it is very easy for a virus like SARS-CoV to destabilize a country or a region, and that has then really an issue on the overall security situation. And therefore, I think we should discuss about health and security in the broader sense of security, where health is an issue that has a huge impact on security of all of us. So bottom line up front, as my conclusion, so we were a bit lucky in Germany that the situation didn't hit us as hard as some of our neighbors, but we learned a lot, and we have to learn those lessons to take the necessary consequences. And military forces can play a significant role, as General Tan Sri already highlighted for Malaysia. And last idea, let's see the crisis as a chance. I think that is such a crisis can give us the momentum to really go forward and to develop new things and to rethink our concepts, and that therefore I think it is a huge chance for all of us. Thank you very much.
Thank you very much, Dr. Rolf. Now, before we take a look at the questions that have been put forward in the Q&A box, we are having a poll right now where we would like to hear from you. We'll give you 1 minute for you to give your thoughts and your feedback on this poll. So in a moment, you will be able to see, I see the poll already. You can see it on your screen. Do you think your country was well prepared for the pandemic? Yes or no? So we would like to hear from you. I'll give it a few seconds over here for you to submit your answers. we can actually see the percentage of whether it's a yes or a no from our audience members. As you can see right now, 63% yes, 38% no. All right. So we have a verdict. 64% of all of you who are joining us today says yes, you do think your country was well prepared for the pandemic, while another 38% said no. So this is an interesting finding, and it's a close call, I would say. All right, with that, let's take a look at the questions that we have in our Q&A over here. Thank you for joining, Dr. Celia North. You have asked whether there will be a protocol of the presentations available afterwards. I've been notified from by MiDAS-KAS that there will be no protocol, but a report will be produced later on. Now we have a question from Mr. Ahmad Tajuddin Muhammad Said, and he's asking, how should the MAF balance its primary and secondary role in the future? Will it affect MAF's warfare readiness? I think this question, I will give this to the team from General Tan Sri's side to answer.
Thank you very much. Well, I also expect that question to be asked. Well, as you are aware that when we started to involve ourselves in the CIMIC operation in response to the pandemic situation, firstly, it all started with when the government decided to introduce the control movement order. In the control movement order, where the police, as the primary agency to do this, were to establish roadblocks and also to ensure compliance with the SOPs. So the Malaysian Armed Forces came in a few days after that, where we enhanced, beefing up the Royal Malaysian Police in terms of manpower and also resources. And eventually the numbers start to increase because additional tasks was required, especially when we decided to increase the state of the control movement orders, such as the enhanced movement control orders, where we have to lock down certain places. This is where the military become very handy, because most of our field asset are ready to be used to do this kind of duties. For example, like where we need to lock down certain substantial big areas where we can afford to have people leaving the area, and because when they already been identified as high risk of infection there. So I mean, human being is always human being. When they know that they're going to be locked down, they will use means and ways to escape and to get out of the area. So the Malaysian Armed Forces came in, and I mean, it doesn't sound or look right that when we put the constitutional wire there, but we found out that that is the most effective way to stop people from leaving the places and reduce the usage of manpower to make sure that the place is fully secured. So this is where we start to come in. Then subsequently, our medical corps add into responding the needs to firstly to add additional human manpower, medical staff to our health ministry, and the other thing is to establish a field hospital quickly, where the needs to put in the facilities, where using our medical core and plus our soldier, where we can, set up the field hospital or field medical facilities fast. And so this is where we become slowly involved in this thing. Then it comes to the question of, when we are doing all this, who is going to do the primary role, which is, like I mentioned earlier, our main role is to ensure the sovereignty, national interest, and also our territory are being protected, or to defend those areas. No, our involvement and the numbers or the resources that we put in to do our secondary role would not or are not going to compromise our state of readiness as far as maintaining the primary resources. As you're aware, the way how the military establish themselves, they have some kind of, reserve force, people who are on the low tempo activities, those who are on the front line at the borders and whatnot, they are still there. So we just need to get our people and motivate them to put in extra effort and working slightly on the longer duty hours, just to make sure that they are be able to assist the country to address the issue of these pandemic activities.
Tan Sri, the next question is also for you from Captain Roger and ZDA. This time is asking about an increasing demand for CIMIC type activities. Now, correct me if I'm wrong, CIMIC is civilian military cooperation. So what changes to the force structures that you can suggest to maintain the full spectrum of military capabilities within the existing baselines?
Well, at the moment, this is not the first time that we are involved in CIMIC activities. In Malaysia, we do face national disaster extent, especially during the monsoon season, where the big flood affected almost half of the country within, the state within the Peninsular Malaysia, where we have to be fully deployed. All our air asset, the army, the land forces, where we have to fully deploy them. That also, looking into that situation, as I mentioned earlier in the first question, that there is not a situation where we will compromise our readiness posture. That will be maintained as it is. At the same time, like I mentioned, I just put in all our reserve force and also people who are on low tempo duties to be put up doing extra hours to make sure that they are able to assist all this. So the question whether that will be disturb our the full spectrum military capabilities, we will still maintain at the same structure. It come not a time yet, gentlemen, that where Malaysia really have to fully deploy or drain out their resources to do the CIMIC activities, where we have to relook at our front line or the front line existing structures. As it is now, with this pandemic thing, we still can cope up with it and using our reserve forces. The other thing that I would like to highlight here is that what is interesting with regard to our action when we are involved in this, as you're aware that the military organization, they are, we consider them as a government within the government itself. We have a full spectrum of the things that we need equipped with us that can do a lot of things in the normal civilian or day-to-day activities. We have our own hospital, we have our own engineers, we have our own telecom, we have a lot of other capabilities in terms of utilities, emergencies that within our control. So when it comes to a situation like this, the first responder, we can deploy the military, establish ourselves, take control of the situation, and slowly the civilian authorities will start to come in and man those areas of calamity. So this is what is good about when you get the military involved into this kind of response. I'm sure in many countries, they have their own emergency response agency. But of course, when the time comes like this, you can never be able to prepare the full spectrum of type of emergency. There are always a situation where the emergency that you expected this come in at the wrong time. So this is where I feel that the military is actually can do the full assistance and responding at the very best time. Thank you.
Thank you, Tan Sri. We have one more question which we will take. This one I would like to direct to Dr. Wan Norhayati. Now, Mimi is asking what kind of regional cooperation from which ASEAN countries that were helpful to Malaysia's response?
Okay, regional cooperation. I would say at the moment, Malaysia is the lead country for ASEAN EOC. So for that matters, because as we know, we can hardly go from one country to the other to offer assistance physically. So the assistance that we are having at the moment mostly is via video conferencing as such, where conference, where discussion is ongoing. With that, hoping that we can share lesson learned here in Malaysia or elsewhere. They shared their lesson learned in dealing with this pandemic. So as for the regional level, the WHO country office, or rather WHO Western Pacific Regional Office, they have this information session. Previously, it was done on weekly basis. Then they stopped because we concentrate on the WHO information session done by WHO Geneva. Now they resume this the information session, the weekly session where we share information, so that with the sharing of information, we know better of how other countries responded to this situation. Hopefully we can incorporate it within our response. As well, on ASEAN level, we are having that kind of platform as well. Thank you.
Thank you very much, Dr. Wan Norhayati. Now, unfortunately, we only have a limited time for the Q&A session. I see that we do have more questions in the Q&A box. I would like to seek the assistance of our speakers here to answer these questions live through the Q&A box. Now, with that, ladies and gentlemen, we have wrapped up session 1. Thank you again to General Tan Sri, Dr. Wan Norhayati, and also Dr. Rolf. Now, we have come to the second session where we will discuss further into the development of SOPs and pandemic measures. Our first speaker is Dr. Ying-Ru Jacqueline, Head of Mission for Brunei, Malaysia and Singapore for the World Health Organization, WHO. She is based right here in Malaysia, actually in Cyberjaya. Dr. Lo leads strategic and policy dialogues with ministries of health and partners. She is an infectious disease physician from Hamburg, Germany, with over 30 years of experience as a clinician and public health advisor. She has been with the WHO since 1998, where her focus has been translating research into implementation. She now oversees WHO support for the COVID-19 pandemic response in Brunei, Malaysia, and Singapore, and the poliovirus outbreak response in Malaysia. Dr. Lo's focus has been on improving public health in Asia and increasing the visibility of Asian expertise in global health. The WHO has been at the forefront of this global pandemic, and it's great to have you here, Dr. Lo. I'll now pass over the mic over to you.
Sorry, can you hear me?
Yes, we can.
Okay, thank you very much. First of all, I would like to thank the organizers for inviting WHO to participate in this very important conference. And I cannot say how much I appreciate this kind of multi-sectoral conferences. They're very important as part of the response. So I was tasked to talk about guidelines and SOPs. So I would focus on WHO guidelines and on COVID-19 and public health and social measures guidance of WHO. So just to remind that the basis for all our guidance is data and evidence, and in particular, the public health and social measures guidance released by WHO is based on understanding how, when, and in what types of settings SARS-CoV-2 spreads in order to inform our guidelines to stop transmission of COVID-19. Just as a reminder, the virus is spread predominantly from person to person in close contact, crowded and closed spaces facilitate SARS-CoV-2 transmission. And the transmission rates in closed spaces appear to be correlated with the duration of exposure. Hence, the longer the duration, the greater the rate of transmission. So this is basically the bread and butter for all our guidance, and they have been revised as we go along the epidemic, the pandemic, and learn about what works and what doesn't work. So the latest guidance, the interim guidance for implementing and adjusting public health and social measures in the context of COVID-19 was released on 4th of November 2020, replacing earlier guidance released in April and May this year. This guidance is based on assessing epidemiological situation, transmission level, and socioeconomic considerations are also considered. Then assessing health systems, public health services capacity, and performance. The key principle of this guidance are to ensure that really agile decisions are based on data and evidence. Data and evidence are that the measures are prioritized based on the context, local context, not only the national context, but also the local context within the country, that they are implemented in a step-by-step fashion, and most importantly, that vulnerable groups are protected to prevent new outbreaks and mitigate the negative impact of our measures. It is important that we make not only individual behavioral adjustments, we are talking about the new normal, but also make the needed structural changes to allow that physical distancing, hygiene measures are possible and face masks are available. So WHO is proposing a stepwise approach starting with surveillance. The first step would be to look at understand the current healthcare capacity, That includes the testing and treatment capacity, numbers of beds, staff, and equipment, and identify opportunities for expansion and adaptation. The next step would be to assess all different public health and social measures by their effectiveness, socioeconomic consequences, and public acceptance, and classify them into priority categories. And last but not least, it would be to determine the current COVID-19 epidemic extent and trend. So the next steps would be really to periodically reassess the situation and balance control measures against the epidemic trajectory and socioeconomic impact, and calibrate the interventions. And there would be a feedback loop going back to step one, and we are recommending that this reassessment would be done every 2 weeks, depending on the country context and the situation. Most importantly, and we have learned that in all countries around the world, that risk communication and community engagement are an integral component of implementing public health and social measures. Plans need to be set up early to allow two-way communication with the public, to understand public perception and sentiment for risk-informed response and compliance to measure, in particular social measures. When measures are adjusted, communities should be fully consulted and engaged before changes are made. And that's not only for compliance, but also for planning. Here we see the proposed situational assessment matrix for calibrating measures based on epidemiological indicators on the left and healthcare response capacity indicators on the right. So we see we are distinguishing a 4-level based on different epidemiological indicators, ranging from no cases to imported sporadic cases at level 0, cluster of cases, and low incidence community transmission at level 1, moderate community transmission, and high incidence community transmission as level 2, and very high incidence at level 3. And that can be triangulated with the response capacity, which is actually a judgment call by the multi-sectoral committee within the country, being adequate, moderate to limited. And I would like to show some examples. But just before, it is really important to note that the listed measures in the interim guidance are not one size fits all. They have to be adapted to the specific country context, as the epidemics are also different from country to country, and the vulnerable groups may differ. So the situation level normal is the basic preparedness, and we've heard about that in the last session. Coming to level 1 with the focus on cases and clusters. And here it is important that we have learned from the COVID-19 outbreak that transmission among vulnerable groups should be addressed early on to prevent later surges. And we have learned that really the hard way in many, many countries around the world, including in Malaysia. So if we look at measures for community transmission level 2 to level 4, we have a low incidence community transmission to widespread and controlled community transmission and uncontrolled community transmission. It is so important to constantly calibrate and communicate guidance clearly from the very onset. Our global recommendation is that even when we have community transmission, be it low or moderate, but even to high-level community transmission, that educational settings remain open as long as possible. And we're looking at childcare services and schools in particular, And unless there are no alternatives, educational facilities should be closed. Similar for businesses, that they stay open as long as possible. And this has been mentioned in the International Health Regulations document presented earlier in 2005, that the impact on trade and travel should be balanced at each step of interventions we are putting in place. So the aim of the social measures are to complement public health measures, which are to test and isolate, trace and quarantine contacts. We have also learned that the effects of social measures, such as lockdowns, are transient unless the public health measures and structural changes have been made to implement that the so-called new normal. So as soon as you lift the lockdowns, cases will recur unless we have made the structural changes required to prevent transmission. And that includes testing and treatment, isolation, quarantining contacts, and tracing and quarantining contacts, and hopefully a vaccine once it becomes available. So we have many challenges, and this conference is a witness of how important it is to address social measures as they go far beyond the jurisdiction of public health. They are effective to reduce transmission, hence stop outbreaks and pandemic. We have learned when we we put in lockdown measures early that the duration of lockdowns is shorter, but they strongly interfere with routine life and livelihood of people and have severe social and economic impact. So they are hard to sustain over longer periods of time. So the recommendation is the implementation should be adjusted regularly based on risk assessment, and they should be measures of last resort. So with this, I would like to conclude that since we are based in Malaysia, Malaysia builds on its strong emergency preparedness and response capacity for health systems resilience, and that the outcomes of public health and social measures depend on the implementation and enforcement of standard operating procedures, but also on community engagement for compliance and planning. I would just like to make a personal plea, and we have heard that also in the session from the presenters before. We have seen that no one is safe until everyone is safe. And now more than ever, we need national and regional unity and global solidarity to control the pandemic, be it for calibrating public health and social measures and ultimately providing rare commodities and the provision of the COVID-19 vaccines. We must work together, and we must not forget the most vulnerable in our societies. Thank you.
Indeed, Dr. Loh, thank you very much for sharing your insights from the perspective of the WHO. I would like to remind our audience members that we will have another Q&A session later after we hear from two more speakers. And also to our speakers, please do be reminded as well that you have 10 minutes allocated for your presentation. Now, our next speaker is Mr. Tajul Arifin, who is the Deputy Director of Intelligence and Crisis Management of the Malaysia National Security Council, NSC. Mr. Tajul is a member of the Malaysian Administrative and Diplomatic Service and has been with the NSC under the Prime Minister's Department for over 17 years. He had previously served as the Assistant Director and Principal Assistant Director at the Intelligence and National Crisis Management Division of NSC. His focus is in the fields of management of national intelligence, national crisis, transnational crime, and anti-terrorism. He was involved in the management and operations of several major crises, including the hijacking of Malaysian ships at the Gulf of Aden and the evacuation of Malaysian nationals from conflict zones in the Middle East in 2011. And now I would like to pass the floor to Mr. Tajul Arifin.
Thank you for the opportunity to participate in this conference. I will speak on the development of SOPs in managing COVID-19 from the Malaysian perspective. Can I have next slide, please? My presentation will touch on the following subjects. The first one is on the Malaysian National Crisis Management, And then on the pandemic COVID-19 management by the National Security Council. Thirdly, on the implementation of movement control. And lastly, on the developments of SOPs, its legal provision, flow of process and challenges. Next slide. In a nutshell, Malaysian national crisis management is carried out according to certain stages and tiers. The level of management will be increased as the crisis continues to escalate or intensifies. Based on the existing setup, in the occurrence of disaster or crisis related to the transmission of infectious disease or pandemic, the mechanism under the National Security Council Directive will be activated, on which National Disaster Management Agency will be the coordinator for multi-agencies response, while the Health Ministry will be the focal agency in terms of technicality and expertise. If the crisis continues to escalate and intensify and could possibly threaten the security of the nation, the National Security Council Prime Minister Department will take over the overall management and coordinate the whole of governments and the whole of nation approaches. Next slide, please. A little bit on the chronology of the COVID-19 management in Malaysia. When novel coronavirus detected in the city of Wuhan, China in December 2019, Malaysia Ministry of Health closely monitored the outbreak based on National Influenza Preparedness Pandemic Plan and getting prepared with the National and Disaster Outbreak Response Matrix or DOM. The first case in Malaysia was detected and confirmed on 25th January 2020 involving tourists from China. Detection was made possible due to the proactive action taken by Ministry of Health, which successfully developed the detection capacity based on the research of the disease genetic sequence once it was publicly shared by China back in January 2020. The first case also triggered the need to activate the national mechanism to control the spreading of the outbreak in Malaysia, and therefore NSC Directive number 20 was activated in February 2020 to coordinate the action by various departments and agencies. When WHO declared COVID-19 as a pandemic on 11 March 2020, it has triggered another level of alarm, and NSC was tasked to prepare action plan for the worst case scenario to control the infection. The trigger point at that time was a religious gathering on 27 February to 1st March 2020 that took place in Sri Petaling, Selangor. It involved 16,000 participants, including 1,500 from neighboring countries such as Indonesia, Brunei, Singapore, Thailand, Cambodia, Philippines, Vietnam, which later caused a sudden spike of COVID-19 case in Malaysia. As a result, series of movement control order was imposed on 18 March 2020 onwards to assist Health Ministry in contact tracing and to break the chain of the virus. This MCO was enforced under the Prevention Control of Infectious Disease Act 1988, or known as Act 342. Next slide. Even though the overall of National Pandemic COVID-19 Action Plan is under NSC, but the role of Ministry of Health as a leading agency is still maintained. Any decision or SOPs must be based on advices and opinions from the MOH as a health technical expert. The overall mechanism under NSC is activated at the district level, state level, as well as a national level. Any decision at the highest level is made by the NSC special meeting chaired by the Prime Minister after it was discussed at the Ministerial and Technical Committee. While at the state level, the District Security and State Security Committee will be responsible to coordinate and implement the decision made by federal government. Next slide. According to the WHO, one of the elements in war against COVID-19, besides implementing a comprehensive public health measures of rapid identification, rapid testing, isolation, contact tracing, quarantine, and so on, is to impose movement restriction followed by the practice of new norms in order to slow down the transmission by limiting contact among people, and to keep the number of cases below the threshold of which our health system can cope with. So the implementation of movement control in Malaysia can be divided into three main phases. The first one is movement control order. Second one is conditional movement control order, and the third one, recovery movement control order. Localities or areas that show significant increase of cases will be put under the enhanced movement control order or total lockdown. This movement control order is a crucial task for the government, while there is a desperate need to break the chain and to control the virus. And at the same time, it is also important to balance the impact on society and economy. Next slide. Okay, the most important issue in developing the SOP for the movement control order is it must have a clear legal provision for it to be enforced. As mentioned previously, the main legal instrument in implementation of MCO is Act 342. The Act gives the power to Director General of Health to impose measures necessary for authorized officer to control the disease and the provision of SOPs issued by the government. Those contravene with this regulation commits an offence and shall be liable to a fine not exceeding 1,000 ringgit or imprisonment for a term not exceeding 6 months or both. Next slide. The SOP of MCO is developed with the following objectives. The first one is to suppress the spread of virus by controlling the movement of people. Secondly, to ensure essential service can operate as usual. Thirdly, to educate the public and industries on the practice of new norms. And number 4 is to balance between economy, social, health, and security. And lastly, to ensure the survival of people and reduce the impact of COVID-19. Basically, the SOPs aim to educate the public on new norms rather than to punish them. The communities must be empowered so that everyone can play their roles by adopting individual protection measures. The step in developing SOP during the MCO can be briefly explained in 6 steps. The first step is to identify sectors and activities which are necessary or need to operate. They also could come from the proposal or request by industry players. Secondly, drafting of SOPs for the proposed sectors and activities by relevant agencies together with the NSC and MOH. Step 3, the draft of the SOP will be reviewed by the relevant agencies that represent the stakeholders in the technical committee chaired by the DG of NSC. This committee also comprises of representatives from Attorney General Chamber and MOH who will ensure that all the SOPs is relevant to control the transmission of the disease and comply with the existing law and regulation. In step 4, the proposed SOP then will be tabled to Special Ministerial Committee chaired by Senior Minister of Defence or in special NSC meeting chaired by the Prime Minister for approval or endorsement or maybe to be looked further. Once approved, the SOP will be gazetted by DG of Health before it comes into force, and then the SOP will be reviewed from time to time. It must be flexible to react to dynamic changing of crisis situation. Next slide. The challenge in developing SOP during MCO can be summarized into 5 points. The first one is what we are facing right now with the COVID-19 is something of unprecedented circumstances. Okay, managing pandemic crisis situation affecting the whole country is something that never happened before. lack of references and understanding available at the earlier stage make it become tougher. And it is like when we lack of intelligence or information, we cannot focus our effort and end up preparing and expecting for the worst case scenario and to do a trial and error approach. Anyhow, the agency's preparedness from the constant reviews and practice exercises of existing NSC crisis management directive help to organize and smooth the interagency cooperation and respond to face the test. Challenge number 2 is the development of this SOP involves various stakeholders. Each of them has different and their very own interests, and we need to ensure a win-win situation for every stakeholder while not losing the main focus to stop the infection and transmission of the virus. Challenge number 3 is to put a balance between economy, social, security, and health. The SOPs developed must be strict enough to prevent transmission of virus, but at the same time must also allow some room for economy and social activities to operate. All the control measures must also consider the impact on disadvantaged groups who often live in overcrowded place, under-resource setting, and depend on daily level of subsistence. Challenge number 4 is the coordination and enforcement at the ground. Sometimes the interpretation of SOPs by individuals or of public or enforcement agency is a challenge that needs to be constantly addressed. It could be the general language of the SOP and the dynamic changes of event that cause confusion among public and enforcement, and invites different interpretation that lead to inconsistency in enforcement of SOP. And lastly, managing illegal immigrants also pose a great challenge. The problem is how we are going to enforce SOPs on group of illegal immigrants. As mentioned before, the adherence to the SOPs are meant to curb the transmission of virus and disease. But how we are going to make sure the adherence of SOP among those who want to remain hidden, always kept themselves out of radar, and at the same time living in the poor condition that permitted for the virus to spread. And it is proven that numbers of spike in cases came from illegal immigrants who breach our border. And with that, I end my presentation, and thank you.
Thank you very much to Mr. Tajul Arifin. Now, for the audience members, we will be opening up the floor for a Q&A session. So please do submit and key in your questions through the Q&A box, which we will address later on. Our final speaker for today is Mr. Heiko Rottmann-Grossner, who is the head of the Health Security Department at the Federal Ministry of Health in Germany. He oversees matters relating to infectious diseases, crisis management, pandemic preparedness, and counter bioterrorism. Before joining the Ministry of Health, he operated for the political party Christian Democratic Union, CDU of Germany, as head of office of the Secretary General. He had also worked as personal advisor to Minister of State and State Secretary in the Federal Chancellery. He also holds the military rank Major in the Reserve of the Medical Service of the German Armed Forces. Joining from Berlin, let's hear from Mr. Rottmann.
Thank you very much, ladies and gentlemen. It's my pleasure to join this meeting. Thank you very much for hosting this conference. I'm glad to participate and happy that you share your experience with us in Germany. To start with, I would like to give a brief introduction into Germany's federal structures, as this is important to understand the reasoning behind some of our SOPs that have been developed and implemented. As you already might know, Germany is a federal republic consisting of 16 federal states with intermediate level governments in state. Our states are of different sizes, with populations varying between just over 500,000 to almost 18 million inhabitants. While the national level is responsible for legislation in most sectors, administration is in general handled on the federal level. Nonetheless, the federal states also have significant legislative responsibilities, such as the implementation of ordinances, for instance, for COVID-19 on quarantine measures. The German federal system is based on the subsidiarity principle. It defines an order of responsibilities whereby next highest level of government can and should support on request of the lower level in case the lower level is not able to act. This shapes the general function of administration and usually results in a decentralization of actions. As a consequence, many responsibilities are placed with the local governments and the rural and urban districts. Thus, for instance, COVID-19 contact tracing and data entry in the national disease reporting system is carried out by the local health authorities. The federal approach applied in Germany gives the advantage of targeting local management on locally emerging problems. Generally, the main responsibility for health at federal level lies within the Ministry of Health and its subordinate authorities, such as our Public Health Institute. In addition, the Federal Ministry of Interior and its subordinate Federal Office of Civil Protection and Disaster Assistance are largely responsibility for civil protection. In order to ensure the whole of government approach, an interministerial crisis management council was activated. This council is co-headed by the Federal Ministry of Health and the Federal Ministry of the Interior, and involves the participation of all ministries, including defense. On invitation, additional institutions and experts are involved to further inform on specific topics. Furthermore, in order to coordinate between national and federal level, regular virtual meetings are conducted, for instance, between the Chancellor with the heads of governments of the federal states, as well as between heads of the Federal Chancellery and the Federal State Chancelleries. These conferences aim to establishing general political frameworks for nationwide implementation of COVID-19 response. So this is important to understand our German federal system. To be concrete, and having said this, one can already describe some of those councils and technical subgroups as somehow standard operational procedures in broad sense. To make it more tangible, I would now like to highlight three key areas where we have developed SOPs and strategies. First, testing. Second, quarantine measures. And third, vaccination. In Germany, testing is an essential component of a comprehensive pandemic containment strategy. Since March 2020, testing capacity to detect SARS-CoV-2 by PCR has been continuously expanded. In May 2020, the country adopted a national testing strategy for the detection of SARS-CoV-2. Around 1.5 million PCR tests are now being conducted every week. Since October, the national testing strategy also includes the usage of rapid antigen tests. Our national testing strategy is guided by three key objectives. First, to ensure appropriate management and medical treatment of COVID-19 cases. Second, to protect vulnerable groups. And third, prevent further spread of SARS-CoV-2. PCR testing is primarily used for symptomatic and suspect COVID-19 patients and in outbreak settings, whereas rapid antigen tests are used for screening purposes of asymptomatic individuals and for quick differential diagnosis with a focus on healthcare settings. The testing strategy was developed in very close coordination with our National Public Health Institute and various other stakeholders to ensure a smooth implementation. Second topic, quarantine isolation. For the second example, as a sort of SOP, I would like to briefly touch on how we manage quarantine measures and processes behind it. In Germany, the respective federal states are responsible for quarantine regulations. After coordination with the federal states and the federal government, the cabinet took note of a new framework regulation on quarantine for travelers, the so-called Model Quarantine Regulation. The federal states now issued their own regulations based on this framework regulation. The Model Quarantine Regulation can be considered as a recommendation of the federal government, which is adopted and implemented for the federal state level. This regulation was developed jointly with all relevant ministries, with the Federal Ministry of Interior being in charge. Different aspects had to be included and a lot of coordination was needed, as you know. This quarantine regulation of the federal states indicates that in principle all entry and return travelers who have been in a risk area for the last 10 days before entering Germany are obligated to immediately enter a 10-day quarantine after entry. The possibility of adding the quarantine obligation by negative test results exist in principle after 5 days at the earliest. Exceptions are possible. In addition, since November, persons entering Germany must register before their arrival in Germany online and carry proof of registration with them on entry. The travel and contact details will be passed on to the respective local health authority. This enables a better follow-up of the quarantine regulation. Third and last aspect, vaccination. Just a moment. Trying to show you a slide. Sorry, this does not work. Sorry for that. Coming back to vaccination, one of the topics that is currently discussed the most is vaccination. The German Vaccination Commission established a working group and developed a risk-oriented, evidence-based vaccination recommendation for potential COVID-19 vaccine. In a way, these are our framework SOPs for COVID-19 vaccination. Due to initial limitations on the availability of vaccines, vaccination will first be offered to specific groups at risk. These groups are to be defined using evidence-based criteria by the National Vaccination Commission, jointly with the National Academy of Science and the National Ethics Council. Priority lies in the development of a close to real-time vaccinations documentation and monitoring system to be placed from the beginning of vaccinations. This shall ensure rapid detection of any side effects or complications caused by vaccination throughout novel vaccines. Furthermore, we considered which structure will be best adopted to implement vaccination. Germany is usually characterized by a quite decentralized routine vaccination system, with vaccinations predominantly carried out by outpatient community-based physicians. To reflect the extraordinary circumstances mentioned and allow for close monitoring, we decided to roll out the national COVID-19 vaccine campaign initially in designated vaccination centers supported by mobile teams. As soon as sufficient quantities of a vaccine are available, the aim is to transfer vaccination activities to the regular healthcare system. Numerous stakeholders were involved in the development of this holistic vaccination SOP. Just to mention a few of them, several ministries, technical instructions, as the Paul-Ehrlich Institute and the Robert Koch Institute, the National Academy of Science, the German Ethics Council, the federal state, and so on and so on. Thank you very much. That's a brief introduction to our complicated German system. Thank you very much.
Thank you very much, Mr. Rotman. Now, with that, we have concluded the second session of today's first day of the MiDAS-KAS conference. There is another poll that we will be rolling right now. So again, we want to hear from you. Again, let's see what this is now. Do you feel that the right indicators and reasons lead to the development of the SOPs for your country? So you can choose whether it's a yes or a no. We'll find out the verdict in a few moments. So we'd like to know from all of you whether you feel that the right indicators and reasons have led to the development of the SOPs in your respective countries. All right, landslide, I guess, with a yes. Right now it's at 93% yes, 93% yes, and 7% no. That's good news to hear that we all feel this way. Thank you very much. And now I'd like to open up the floor for a Q&A session. I know that Mr. Rotman, you touched just now on the distribution of the vaccine. We have a question here. One Muhammad Kamil Wan Muda is asking, what method should ministries adapt in the distribution of the vaccine to the people of the country? What is the order of priority? I think some of us may know that the frontliners and healthcare workers and individuals who are at high risk would be the priority groups to receive this vaccine first. Perhaps Dr. Loh and also Mr. Rotman can also elaborate on this. Dr. Loh, let's go to you first.
Yeah, thank you. So WHO has been working with partner organizations to look at prioritization for vaccinations. So the purpose of the vaccination is first to maintain essential services like health services. And then the second would be to decrease, to protect the most vulnerable who are developing severe disease or die from COVID-19. So the first group is healthcare workers and other frontline workers, which make about 1% of the population, and then followed by the elderly above 65 years of age, and then those with underlying disease conditions. So this is what I understand has been decided by the German STIKO as well as a recommendation for the vaccination approach.
Mr. Rotman, the next question from Chen Eng. Do you think the multi-sectoral platforms for exchange created in Germany during the pandemic will remain open for regular exchange even after the pandemic is over?
Thank you very much for this question. That's a very good one. We haven't decided yet. I'm sure that there will be a mechanism in the future where we establish a new form of pandemic preparedness, and we will establish new cooperations between our federal level, the state level, and the local level. I think we have to rethink all these coordination, including the civil military cooperation. We are glad for the support by our armed forces. Thank you.
Now, I want to go back to the distribution of the vaccine. This question is for Mr. Tajuh Arifin. I think things are still a bit vague right now, but how do you foresee for us to ensure a smooth distribution of this vaccine to the people of the country?
I'm sorry, is it the question is
how do we ensure a smooth process?
I don't think I'm the one to answer that question about vaccine. You should ask KKM, I guess, Ministry of Health.
Perhaps Dr. Loh, you could elaborate.
I think that's what I understand is that there is a planning process ongoing in the Ministry of Health and the Ministry of Science and Technology, but obviously led by the Ministry of Health. So we have been looking at the vaccine preparedness. We have a tool from WHO and UNICEF and gone through. So most of the elements are actually in place in Malaysia, and we've been planning together for capacity building, and particularly in the areas of regulatory and adverse events monitoring and indemnities. So for the distribution, we don't have a final decision because the plan has not been published, but I understand that it will be in line with what the WHO and the global platform COVAX has been recommending.
And also another question also for Dr. Loh. Do you think the communities in Malaysia were involved enough in creating the SOPs?
Well, that's maybe a question to the National Security Council.
Perhaps Mr. Tajo?
Yes, maybe I can respond to this. What I think about the involvement of communities in creating SOPs, I think this SOP is an ad hoc SOP. It takes it needs to be produced in the short time as fast as it can, and must be flexible. The difference is the normal SOP is created before crisis happen, but this SOP is created when we are dealing with the crisis. So I think we try our best to get views from the public. Like I said before, when we produce the SOP, we try to get the agencies or that represent the stakeholders. Well, we cannot afford to get the view of everyone in the country, because we are against, we're running against time to produce the SOP. I think
Mr. Tajo, we're now in the third wave of the pandemic in Malaysia. What do you think differed from the first time when we had the MCO in March, when we had a full lockdown? What differed in the development of the SOPs in the CMCO that we are under now?
Okay. At the earlier stage, when we imposed MCO, that was easier than the conditional one, because MCO is like a total lockdown. Only the essential service allowed to operate. So it's easy. The SOP also easy. We just lock everything except for the essential service, and we just listed down what is the essential service that can be operated during that time. But when as time goes, we need to consider about the economy impact on the country, to the country. So we think of opening a few sectors and activities. So that's why it came to a conditional MCO, which we allow certain economies to operate. And then, of course, SOP become more difficult and challenging. When we want to lock down to stop the transmission of disease, virus, and then at the same time you also want to allow economy to operate, and that's the challenge. And then when we overcome we managed to lower the numbers of cases and control the virus in the country, and then we adopt the recovery MCO. Recovery MCO is supposed to be our exit strategy from MCO, but unfortunately we face the third wave of virus, and then we have to go back to conditional MCO.
Right.
So that basically the flow of the process and the SOPs.
There are many things and factors to consider. The next question is also for Dr. Loh. You highlighted that the WHO's guidance recommend keeping schools open unless there is controlled community transmission and no alternatives. Can you comment on how this is being translated in Malaysia?
So maybe just at the onset is to say that the measures social measures to prevent COVID-19 transmission are their cultural preferences and context-specific preferences, particularly the schools. There has been a contention in many countries. But I think what we have seen now is that because of the long-term effects on children and younger adults or the children in particular who don't have very high prevalence or the risk of transmission is relatively low, we recommend that the schools remain open as long as possible. I understand in Malaysia that in the CMCO areas, the schools have been closed and that the holidays have been advanced. So I think it's worthwhile to look at, with Ministry of Education, at a proper risk assessment for the schools. So but I understand that maybe the cultural context also within Malaysia doesn't prioritize schools as, and education as on a top priority. And we have seen that in other countries in the region as well. So like, for example, in Singapore, schools from the very beginning were open very, very early on and was a priority because also the parents work and parents can't work if the children are at home and they don't have all these facilities. Whereas in other countries like Republic of Korea, it was less a priority, and because they had other means to continue. So it's very important within the cultural to look at the cultural context. So.
Dr. Loh, the next question comes from Abdul Karim Mustafa. He's asking, what is your opinion on creating the bottom-up SOP that will reduce the risk of the pandemic? And how do we develop awareness about future biological disasters?
Well, I think it's important to have a feedback loop for standard operating procedures, or let's say guidelines and then standard operating procedures. As I said, it's good to have risk communication and community engagement. That means to have some kind of mechanism where you can get feedback, social listening, and on social media or surveys, behavioral insights to understand what the community thinks, and that should not look only at the general population, but also at the employers, for example. That they are heard, or people who work in detention, prison, and also police. I mean, they were all affected in Malaysia. They are part of the community, right? So I think there are mechanisms, but maybe as we learn now going along with the epidemic and become firmer in the SOPs and how they are implemented, maybe also room for opportunities to listen more. So I do have a question to Heiko Rothmann-Grosner from Germany. What is the mechanism you used in Germany to get involve civil society or the community in developing standard operating procedures, or also to learn from them what are the issues around adhering to standard operating procedures issued in Germany?
Thank you for the question, Dr. Loh. As you mentioned in your presentation, the key point is risk communication. And we are deeply involved in several ways of risk communication, and to get to the people and get them involved. That is still a problem, especially in these days when we are looking at our Christmas holidays now, to get the people and take them with us. In a way, the people are a little bit tired about this pandemic situation. So we have to stress this again and again to make them sensitive and sensible for this pandemic still. Sorry.
Mr. Rodman, you are on mute just now. All right. Thank you very much, Mr. Rodman. That concludes the first day of the MiDAS-KAS Conference 2020, Pandemic Response and Beyond. Thank you again to everyone who has joined, and thank you to all of our esteemed speakers we heard from today. Thank you, Dr. Loh, Mr. Tajul, and Mr. Rodman just now for the second session, all with impressive credentials and experience, whose expertise is more vital than ever these days. Now, to our audience members, don't forget to join us for a second round tomorrow with another lineup of brilliant speakers who will talk about the effect towards security and the impact beyond health. With that, see you tomorrow on Zoom again, same time. Thank you.